Speaking of the gene and types, do you feel like it's important to be tested for what type of gene? Does it change the therapy? Does it change the progression? A lot of people ask, what if I don't know?
Yeah, I know. That's a good question. I think from my perspective as a researcher, I don't know necessarily why that would make a difference if you have a phenotype. So for instance, we study different models of PKD with animals, and they all have various mutations that cause PKD. And we treat them as though they're all PKD, even though we understand that there are going to be differences in the outcomes or the phenotype of these animals. And we'll still treat them as though they're analogous to one another. But some are more closely related to human diseases, and some of them are a little bit different. And there's little reasons why, like I mentioned, with some of them being these other proteins that aren't the PC1 proteins, which we kind of call the human disease because they're the majority of the cases. But they don't necessarily change, I think, on the specific thing because they result in a similar phenotype. So whatever polycystins do and whatever cilia do, the disruption in them leads to a similar phenotype. So it's unclear whether or not is the calcium channel that's being disrupted or if it's this cilia-associated protein that's disrupted, resulting in the phenotype. It's unclear how that would benefit you to know that. And I know that there are negatives of being genotyped and that maybe insurance will now save a pre-existing condition or something like that. I know that that's a concern some people have. Yeah.
Speaking of that, since we're talking about genetics, how do you feel about the current genetic therapies and what's happening with genetic therapies related to PKD?
Yeah, so I think there was a paper by Somlo's group. I think that's probably the one that people are familiar with right now that came out where they reversed PKD using a genetic knock-in. So they deleted PKD1, then they allowed cysts to form, and then they reintroduced PKD1 using a genetic manipulation, and they showed that there was regression of the cystic disease. And that, I think, is very interesting. It says that this is a disease that is reversible. It's not just a one-way only, just always progressing towards renal failure. So that was a really good proof of concept. The tricky thing will be delivery. It's always going to be delivery of anything like that. How do you get specificity for the cells that you deliver it to? How do you ensure that you don't get off-target effects? How do you ensure gene dosage in particular cells? So those are where you have to have really good targeting mechanisms to get things to specifically where you want. And that's always the barrier. The barrier is not the technology of being able to do it. It's, are you just going to get cancer from introducing a ton of other genes into other cells and inappropriately expressing proteins in places they don't belong? Yeah, that's really the only barrier. I don't see it. Theoretically, it's very feasible, right? You can do anything in animals. Animals, you can do a lot more manipulations. In that experiment, they didn't introduce the gene exogenously, so they didn't do like a virus. They actually had both versions of the gene already in the genome, one that they could turn off and one they could turn back on. So like a silent version that could be turned back on later on. That's because they were able to set up the embryo in such a way that they manipulated its genome to do that. In humans, of course, you would have to be introducing this into adults in order to do a therapy that is going to only kidney cells. Would be very challenging procedure. Yeah.
Sure. And as someone who's had PKD myself, I know for certain I wouldn't change this diagnosis for cancer or
Right.
something like that. At least there's therapies here and an option. This tends to be a really personal question, I think, to PKD patients. So if you do have children and you're unsure, do you feel, and again, so this is just an opinion because I have an opinion on this too, should your children be tested for PKD and when should that happen? Being a dietitian, of course, with my children, I have absolutely instilled overall good eating habits. With room, they're still kids. I educated them about the disease as best as I could. Obviously, they've watched me go through it. Obviously, watched them, monitor their blood pressure, increase that physical activity, basically done all the things that I thought I possibly could do. And until they came to me, or none of them has showed signs or symptoms yet, but until they started to show symptoms, I never really felt that I would do anything differently with them in the beginning. So I guess I'm curious to hear about
Yeah, I mean, I have kids as well, so I think I feel pretty similar. If you're choosing to have children, I don't know how I would treat it if they had PKD or not. It's a tough question because I didn't determine the sex of our children before they were born. Like, I don't want to know. I'll just find out. But some people can't live without knowing. Like, they have to know if it's a boy or a girl before. In that way, it's like, I'm fine not knowing. I think that nature is going to figure it out. So I'll figure it out with the same time when they come out. And so I think the same thing I would try to instill all of the same healthy ways of living and making sure that it's possible you could have this disease, but we're not going to know for many, many years. So you just want to be very cautious about preventing injury to your kidneys and injury to your body. And that's kind of what we'd be doing anyway. So that doesn't change it for me, at least.
It is. I have one son and he plays contact sports, of course, football. He's 15. And I think about it's probably better off me not knowing and watching him play those kinds of sports. But as you said, institute measures of extra protection and make sure, there's extra padding there just in case.
Right.
So I agree.